The world of public health is very much into cancer control. And if you take the examples of colorectal cancer and breast cancer and ovarian cancer, there are a set of activities that are done by public health. And each state has a cancer division. They even have cancer registries with mandated reporting of all cancers in each state. So I think many states have started a number of activities to increase the level of awareness about these hereditary conditions. And depending on the expertise and fundings and resources, they've worked with the healthcare providers in their community and general educational campaigns to the general public. What's good with the availability of the cancer registries is that you can interact with reporting, the cancer reporting from the cancer centers. And for example, in the case of Lynch syndrome, you can figure out and do a bidirectional reporting between the cancer registry at the state level as well as the reporting entity in the state, because you can figure out how many cases of colorectal cancer have been tested for Lynch syndrome. I think the recommendation, which I did not state, is that all new cases of colon cancer should be tested for Lynch syndrome, because once you find a Lynch syndrome in a case of colon cancer, you can cascade to the relatives, the first-degree relatives who have a much higher increased risk of colon cancer than the general population. And if they have Lynch syndrome, they need to start screening earlier than the usual 50 years sort of recommended age cutoff for the general population, and will be in the 20s with more frequent screening. So depending, I mean, each state is doing it slightly differently. The Division of Cancer Control at CDC is funding a few of them to do activities that fall in three general areas: surveillance to figure out what's going on, education of the providers and the general population, as well as working on policy efforts to increase awareness and coverage for saving lives from these conditions.
Another approach to identifying individuals at risk is by identifying individuals who already have cancer, and because they might have been diagnosed at a young age, might also be at risk for having a hereditary syndrome. To do this, we can use public health infrastructure such as cancer registries that collect information on all cancers diagnosed within a given population. Information that we collect through these registries includes age of diagnosis, and by using this information, the registries become a valuable resource for identifying families that might be at risk. Here in Colorado, we did do a pilot study to see whether we could use cancer registries to deliver an educational outreach to individuals at risk for hereditary colon cancer. We identified patients that met certain criteria based on their age and certain histologic cell types of their colon cancer. And we used the registry to deliver a message to these individuals about hereditary colon cancer, Lynch syndrome specifically, who's at risk, what the implications are for the family and for the individual in terms of screening. This was one of the first projects in the country to investigate whether a registry could be used for this purpose, and it was very successful. Overall, we found that physicians were very supportive of the registry delivering this information directly to their patients, and they were very supportive of the materials that we had put together for their patients as well. We also surveyed the patients at the time that we contacted them to ask about how they felt about being contacted directly from a cancer registry. And what we found was that patients were not angry, they were not mad. In fact, most of them wanted more information about hereditary cancer. So in that regard, we feel that this project provided strong evidence that registries can be used in this capacity to deliver these messages.